Hey everybody, Dr. Waters, Platte River Foot and Ankle Surgeons, here today with Terry.
Hello.
Hey Terry, thanks for coming by.
Yep.
So Terry's one of my awesome patients, and she has a great story experience, and we love patient stories here, so I'm going to turn it over to her. Kind of tell us what you're experiencing, why you came and saw us, how it was affecting you, all that kind of stuff.
Back in March, my son and I were downing some trees for hedge posts, and one was too big for us to move, so I got the chain around it, and he moved the bobcat. I didn't move fast enough, so it rolled over my foot. So I was having a lot of just pain, instability, things like that. Tried to handle it through my local doctor. We tried a walking boot, we did x-rays, things like that, but it just wasn't getting better. So I think it was in May-ish I come and saw you.
Right,
Then at that time we ordered an MRI.
Yep.
And put me in a walking boot up until we had the MRI. Then decided that what we needed to do was surgical after that, and had my surgery in June. Then started walking in August, I think it was. Did some PT, and I was completely out of everything by mid to late September.
Nice. So go back to after you downed the tree, like what like kind of symptoms might you be experiencing, or how is that impacting what you're wanting to do or could do?
So I had a lot of swelling, a lot of instability. Just my foot just didn't work right.
Yeah.
Some numbness and tingling, but not a lot there. That I wasn't able to. I'm very active on the farm, so I wasn't able to do a lot of the chores, carrying things like that. So I knew something needed done to continue my life.
What, like when you say you couldn't do it, was it because of pain when you would try to do it, or did you feel more unstable when you were trying to do it?
Some of it was both.
Both, okay.
Pain and more probably the instability, not knowing if I felt secure enough to be carrying things. If you felt like the foot would
give out on you, like when you're, very common with patients with instability that I hear those kinds of things. So, and that's always tricky, when you want to want to help out on the farm, want to, if you're an athlete, want to do, you're at sports, but you don't feel like you can trust whether that foot's going to be able to handle the load that you place across it. So, so that's good. So you're kind of doing that. So you kind of dealt with it for a few months, with your primary care doctor, right?
Yeah.
Tried a boot. Yeah. Did the boot help? I mean, give us some of your thoughts about...
It did to an extent, but it didn't improve it.
Yeah.
When I got out of the boot, I also had just a post-op shoe.
Yeah.
Tried that. It worked fine while I was in it because it provided the stability, but then after that, when I'd take it off, it was the same as it had been.
So that's very common. Like, patients will get in a boot, everything looks great, then we'll try to get them out of the boot, and then they still have those instability issues going on. So needless to say, you tried some non-surgical things, which I think is always a good idea. And then you got referred to me after that, right?
Yep.
So we did an MRI, right?
We did an MRI, and just determined that there were some ligaments not attached, torn, something that needed reattached, and had some arthritis issues in my ankle, so we went ahead and scoped that. And I said, well, I'm here, fix the bunion too, because you're not going to get another chance. So I just had everything done.
We did. One-stop shop here, right?
So, it was.
But no, that's very common, like with instability. And one of the reasons, like, we try to take care of instability is because patients who end up with prolonged instability end up with really bad ankle arthritis, and then that necessitates, unfortunately, ankle replacements or ankle fusions, which are much bigger surgeries and more involved. So I am always grateful when I get them early at the instability stage versus later. So good. So tell us about now. How is it going? Your thoughts about your ankle, your foot?
I want to say I'm basically back to I was pre-injury. Awesome. I do everything that I was doing before the injury.
On the farm?
Yep. Yeah. I carry buckets every night. Nice. I do everything that I was doing before.
Awesome.
So,
Love to hear it. So, no, are you wearing patients will want to know, are you wearing a brace? Or are you doing anything like that? No brace?
Yeah. Just whatever shoes I have on.
Whatever shoes you have on. Yeah. You feel totally stable. Good.
I do.
Bunion's good. Yep. Bunion hasn't come back.
Nope, it has not.
That's good. So you're happy you did it?
I am very happy I did it.
Good.
Yes.
Good.
Yep.
Well, that's great. So I mean, and that's what we're here for. And like Terry said, if we get them early, if you're somebody who's a chronic sprainer who feels unstable, there's some really good surgeries we can do to get your ankle nice and stable that don't require, replacement fusion, things like that. Some of my patients, I think, really worry that those are the only options that are available to them, and we've got other good things available to them that you can maintain your normal motion or normal anatomy and get you back to a very good functional stage, that was my goal.
Yep.
When I thought about your case. I was
Yep.
like, let's get her back to doing the things she can do, feel stable, and zero or very little pain.
Yep.
Would you say that that's the case?
Absolutely.
Good.
I had no problems post-op,
Good.
no problems with physical therapy, nothing.
Good.
So,
Well, we appreciate you coming down. This is what we're all about, Platte River Foot and Ankle Surgeons, taking care of these patients and making sure patients get back to their functional status that they want to be at. So if you have any questions, concerns, give us a call. We'd love to see you down here. Thanks.